70 and. Sounds like I arrived last night, I was like, yeah. To finish. But yeah, we're going to get to a more easy.
Yeah, it's crowded right now too. I feel like all the spring break families and everyone's here.
Yeah, I know. A couple of weeks are.
Yeah, that must be this traffic get crazy around.
I think about 5 minutes from the venue.
I tried to ask her like, how far are you going?
For a day.
Yeah.
So easy. That's like everyone else's dream to just like pop over.
Right, it's such a school, yeah, we can have to do it.
Yeah. I get it, it's people.
Are you gonna go to Coachella?
Are you going to Coachella? Oh, I don't think so myself. Not that kind of craziness.
Alright, so we're gonna go ahead and call, are we ready to go?
We are ready.
We're gonna go ahead and call this meeting to order. Welcome everyone to the Fisher District Board meeting, special meeting of the Board of Directors, March 30th. 4:30 p.m. Can we go ahead and get a roll call?
Director Smith. Here. Director Rogers. Director Perezio.
Here.
Director Lawson. Secretary Delara.
Present.
Vice President Rodriguez.
Here.
President Peraza.
Thank you, and if you could please join me for the pledge of allegiance. Right now with your heart. I
With allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Next item C, approval of the agenda. I'll move approval.
Second.
All those in favor say aye.
Aye.
Being no opposition, we're gonna move forward, agenda has been approved. Item D, public comment. At this time, comments from the audience may be made on items not listed in the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed in the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Any public comments?
Dr. Sullivan, did you have a public comment?
Yes, I did.
And you have 3 minutes.
Welcome.
You're welcome to come over here if you can, or you can stay there, whichever's more comfortable for
I'll see you, is that okay?
That's fine.
All right. So I'm Dr. Catherine Sullivan, and I submitted a public comment to the board. And I did meet with Director Rogers this morning, to talk about access to healthcare for underserved communities. One of the things that we discussed was how to have more impact from our grantees. So what I'm suggesting and what I'm asking is that I have quite extensive experience in grant evaluation, in education and training of healthcare workers, and in data management. And especially now that we're in the age of AI. I have to tell you a funny story. I talked to my son this morning. He said, I'm not a very good mother. In order to find out how to be better, I should do AI. And it will tell me what to do. So guess what? My friend Ricky said, go ahead and tell him you did it. And 2 or 3 days from now, call him and tell him that AI said, call your mother. So what I'm trying to say to all of us is that after the pandemic, things are different. We have to deal with technology, and we have to deal with our understanding of brain science. And there's a lot that's going on near young people right now. They're confused. My son actually thinks I'm not a therapist, and I am. who thinks I'm just a physical therapist. I am a physical therapist, but I got my degree in 1978. A few things happened to me since then. And so what I'd like to do is to request that I be able to consult with the board, with the grantees, on maybe ways that we can look at what they've done and extend it into even higher impact in terms of access to care to underserved populations. Like me, I'm an old lady with a disability who happens to be a physical therapist. Okay, so that's my statement to the board. So thank you.
Thank you. Any other public comments?
It doesn't look like we have any others comments online.
I would like to.
You have a public comment? Okay, go ahead, Jenna, you have 3 minutes.
All right, thank you. For those of you who don't know me, my name is Jenna LeCount Heinley. I am the CEO of HARP, Health Assessment and Research for Communities. And as many of you may know, HARP was originally created by Desert Healthcare District and Foundation 20 years ago. And part of our main purpose is to do the Coachella Valley Community Health Survey, our population health survey of our community, and provide that data back to the community free of charge. And we have done that 7 times. We just released our most recent data for 2025. Thank you to those of you who were there. As I shared at the event, HARP is struggling financially right now. It's a combination of many factors, including contracts that haven't come through, various federal funding being cut, delays, the fact that many of our largest clients are also experiencing uncertainty and are unable to hire us for the evaluation and the needs assessments that they usually do. So we are struggling financially. And I would like to see if there are ways that Desert Healthcare District can do anything to help us keep our doors open and to keep a valuable resource for our Coachella Valley. And so since you are now doing strategic planning, I'd like to see if there's a way that HARP's skills in collecting community-based data and making that understandable and easy for the community to understand, if those things can fit into your strategic plan and your work and the staffing and various other ways that you plan on doing your work going forward. So I'm here to hear more about what you all are doing and to hope that it can dovetail with what we are doing so that the work that HARP has done for our community for the last 20 years doesn't go away. Many of your grantees rely on our data. Many of the healthcare agencies do as well. And in this era of when federal data is going away or being redacted, or when diversity isn't being explored or supported, I think it's more important than ever to have our local data that is locally driven and locally owned and locally used. So I look forward to hearing more today and on Wednesday. And if you have any questions, I hope to chime in. But basically, I'm here to see if we have any good synergies that could help us stay open. Thank you.
Thank you. Thank you. Any other comments?
I don't believe so. Let's see, so I don't see any hands raised online.
All right, next item, the strategic planning workshop. It's E1, finalization of tactics, prioritization, and impact measurement. Dorothy?
Thank you so much. All right, I'm gonna stand up so I can see everybody because we're at this long table. Please let me know if I'm in the way of the board. Angela and Billy, can you hear me okay?
Yes.
So on the sewing team, we also have Dr. Edward Jeter, who was here last time, and Billy Powers. So I just want to make sure that they're introduced. And I have Ori Carmel and Leah, which I think you know, I think we've been here a few times. Okay. So let's get started with our V2 workshop. So this is a very exciting time. Let me just ground everybody in where we are in the process. So we have just completed the community engagement sessions, which were really wonderful. We presented the findings to the board just last week. And now we are officially entering this version 2 of the strategic plan, which means that we are going to finalize the plan and we're going to co-design together to finalize that plan, okay? That has always been our intention. And that means that we're going to review a proposed V2 today that includes key initiatives and goals, and we're going to give you a toolbox of tactics that we're going to talk about. Again, then we're going to finish and present everything early May. So as President Barraza said, this is coming to an end pretty quickly. Okay, next. All right, so this is the project roadmap until that final delivery. Today we're going to talk about, okay, I'm going to let that happen.
All right, there we go.
Okay. So today we're going to finalize the key initiatives and we're going to review the tactic toolbox that you have available to you and how that's going to be implemented. And if we have time, we'll start on the impact measurement framework, but if we don't have time, we'll do that on Wednesday. And then we're going to have another session with the board to talk about the financial sustainability framework. So basically it goes in a very logical order, right? We agree on the strategic plan, and then we talk about how we're going to measure the progress of that strategic plan, and then we're going to talk about how you finance that strategic plan. Does that make sense to everybody? Okay. All right, so let's see what we're going to try and do today. And again, I never know with this group if it's going to take 10 seconds or longer, so I'm not going to set any expectations. All right, so what we're looking to do together, as you know, is to create this 5-year strategic plan. And we are going to co-design to make sure that everybody's voices has been included. Okay, I think we're familiar with this. We have discussed many times, but I think it's important to summarize how this is a very specific moment in time for this organization, and there's a real opportunity to meet your full potential. And, you know, in order to do that, we agreed, and it resonated with the community, that the district can help act as a health system amplifier, right? Just go from just being a grant maker to really creating amplified impact on the community. What we're creating and what we've created for the last 8 months, and you've invested a lot of time and dedication and money, must serve as a true north for everything that you do going forward. Every decision, every action must be guided by the work that we do today. Otherwise, perfectly honestly, it's just a document that sits on somebody's desk and it's a waste of money. So we all have to commit to that. This strategy is going to enable us to focus your work and your resources on the biggest needs of the community to make the greatest impact. So whenever we feel uncomfortable or we feel challenged, we have to remember that at the end of the day, this is why we all showed up to do this work. It's going to take a little bit of growing pains because a strategic plan is not just a paper document. It means that the organization has to grow and change and adapt. And the most significant change that we anticipate for you as an organization is to become a very much a proactive organization, right? Because you have this strategy, so you know where you're heading to. You're not just reacting to grant requests, ad hoc, and it gets very exciting, right? Because you have more money in this moment. So it's like, wow, we have money, we can just say yes, but you can't. You can't just say yes. It has to be strategically grounded because you've done all this work. It also means that there will be an implementation plan that needs to be added to the strategic plan. We're going to work with the staff. It's not just going to be like, here's your strategy. So how does the organization adapt and evolve in order to implement this strategic plan? And that's going to mean some organizational shifts. We anticipate, for example, that you're going to need more staff. There's new roles that need to be filled. There's no doubt about that. And there's some governance shifts, right? That also you've been working with Larry. Larry, I think you're on the call to talk about, like, what is the role of the board? What is the role of the staff? How can you continue this collaboration that you've done so well in doing in the last 8 months? But again, all of this takes time and it doesn't happen overnight. So I just want to set expectations. Does anybody have any reactions to these, like viscerally or anything they want to share? Or is it fun? Sound good? Okay, so you're lining a head nodding. That's great. So from the community sessions, I just want to remind us as we go through this final strategic plan, there's a couple of things that we should keep in mind. Overall, the organization's true north and the 4 proposed strategic pillars and the key initiatives resonated with the community, and it is, reflective of the most pressing needs and where we can create the most impact. So that's great. There was definitely a head nodding and agreement that including the social determinants of health, which is another topic that has been very, very prominent in this project, is a good idea, right? And it will help us reflect the needs of the community and the diverse community that you serve. So that's great. And then if juncture with that, we need to keep in mind all those spotlight communities that have specific needs and that are not currently being met. Okay. So I just want to go back and say, this version 2 comes after the community sessions. It comes after the prioritization exercises that you did. It comes after the survey that we did for the community. But I don't want everybody to forget that it also includes all the other data that we looked at for V1, right? So this is a really big, robust data set that we're using to make these recommendations, both qualitative and quantitative. I think you're all familiar with these reports, but I just wanted to remind ourselves of like, somebody looking? Do you think somebody's looking?
Scared.
Okay. All right, so what are we gonna do today? Today, we're gonna go through the strategic pillars, the goals, the key initiatives, and the tactic, and we're gonna get agreement on the strategic pillars, goals, and key initiatives. We're gonna get everybody to sign off so that we can start talking about impact measurement. And then we're gonna review the tactic toolbox that's available to you, and I'll go more into that in a minute. Okay. So let's go to the Miro board, which is a little hard to read. So as always, we've given you printouts so you can look and follow and take notes to anything that you want to share, and then you can share it as we go along or at the end of pillar 1. Okay, so let's just remind ourselves that the pillar 1 workforce development equitably increase the workforce of primary and specialty care and behavioral health professionals was validated. Everybody agrees that is a good first strategic pillar. Under that pillar, there are 2 goals. The first one is recruitment. What we've added here is a very small change, but we put behavioral health because it kept coming up. Hello, Carol. Welcome. Okay.
And Sophia, I'm just gonna make a quick comment. In your packet, there's the V1 pillars, and then there's the V2 one. So if you want to look at those side by side. But what we're presenting now should be later in the packet. So it should say proposed V2 pillar 1.
Thank you. Thank you for that. Carol, I just want to bring you up to date that we are going through the V2 proposed plan today. And that we're going to get everybody's agreement on the pillar, the goals, and the initiatives. And that in the next day or so, we're going to go through the impact measurement and the financial plan. Is everybody okay with finding V2? It's really important that you're on the right page. All right. All right. Everybody good? Okay. So as I said, workforce development was definitely confirmed as a top priority in the community. It was confirmed by the data, it was confirmed by the board and the survey respondents. Okay. What we have switched here is grow your own healthcare workforce pipeline. We put as number 1, just to reflect that that was the one that came up as the most compelling. Okay. So somebody should we be looking at V2? V2. Everybody should be looking at V2. We only have V1 as a reference in case somebody had a question about what it used to be like. But V2 is what you should be looking at. V2. Okay. Here, Carol, do you want to? Yeah.
Thank you.
First half of this side. It's just a preference. So you can see what you-
Okay. Everybody good? It's totally fine if we need to stop, make sure everybody's on the same thing. Okay, so I'm just gonna take you quickly through the changes. So we used to have behavioral health as a separate key initiative. And it was clear that it needed to be part of all of the grow your health, your own health, grow your own healthcare workforce pipeline and the recruitment incentive program. So we just added that in instead of having it as a key separate initiative. So that's really the change there, okay? And then, sorry. And under goal point 1.2, retention and retain a skilled, stable, and culturally responsible health workforce that can deliver high quality care across the district. Again, we put behavioral health in this. Everything else,
And those were switched, 1.21 and 1.22.
yes, again, to reflect that it came up more frequently and was seen as a higher priority. Okay?
You going through the tactics?
So is there any feedback, any questions, any disagreements, any reason or anything that you would like to discuss before we approve this level? So again, I may sound a little repetitive tonight, but it is really about developing muscle memory. This is what you are agreeing will be your North Star. So when an initiative comes in, everybody will look to this and say, is this contributing to this pillar? Is it gonna help us reach our goal? Does it match a key initiative? And I wanna also stress that there will be times when there is an opportunity, like say COVID happens again. God forbid, but gets, you know.
Well, that's a lot of money though.
The greater ones. So, you know, we understand that there will be some flexibility that's needed, right? There's some flexibility that's needed, but this should be really, really like the norm. And everybody should feel comfortable on the board level and everybody should feel comfortable on the staff level. And when I talked about governance, you know, this is where the role of the board really sits, is to guide the organization strategically. Okay, so under each key initiative, we have a toolbox, a tactic toolbox. And that tactic toolbox is a repository of all the ideas that have come from our discussions, from the community, from, you know, the data. But they're not, oh, you got to do 1, 2, 3, 4, 5. It's for the staff to evaluate, you know, grantees that come and say, I can help you grow your own healthcare workforce. And they have to evaluate and say, is that true? What's the data say? That's where the toolbox comes in. So, but we put it here just so you feel like it's reflected, that we've captured everybody's ideas. So Leah, can we maybe, for example, go under key initiative?
Can I, you know, in the last strategic action plan, certain sections were prioritized. I just want to confirm that all 4 of these pillars are the priority pillars that we have as a district.
Yes, and that's a really good point. So pillar 1 and 2 are the priority pillars for funding.
Okay.
Right? Pillar 3, and Leah will, actually I'm presenting pillar.
I'm sorry if I'm jumping ahead. Okay.
It's good. And pillar 3 came in just slightly less as a priority. And remember pillar 3 is all about partnerships. Right? And we were talking with Chris today, like maybe this is where the foundation plays more of a role. So in terms of funding priorities, it's really pillar 1 and 2. right? Because those are the greatest needs that were identified in the community.
Yes, I get that number one and number two are the greatest needs, but I don't think that we should put higher priority on those two and lower priority on the other two. Can't they all just be the same level?
They are the same level, but they're also going to be funded differently. So pillar 3, the priority is not funding, it's building partnerships.
The
And-
leverage funding.
To leverage funding, to maybe leverage the RFP.
I guess I don't like the idea, I think before, we felt the need to prioritize because of limited funding, we didn't wanna overspend, we were very, we all knew that we had some major decisions to make. But when I think about data driven, when I think about partnerships, I don't think that they are going to be at the same level of funding as number one and number two. The resources are gonna be more on 1 and 2.
Correct.
But I don't think that, I don't want us to go into this thinking that they're somehow lower priority.
Right, and I don't think, and I take your point, I mean, if visually, they're gonna be the same. And it's just how they're implemented, that's really the difference.
Yeah, and that's why I'm glad you brought up that.
Yeah, because I think that's where we have to be careful in how we message this, is that these 4 pillars are the priorities of the healthcare district. As the healthcare convener catalyst, I use catalyst in one of those podcasts. But
Amplifier, yeah.
but I get where you're going, is that the majority of the funding that we'll take from 1 and 2 will probably come from the district. I just don't want, to Letty's point, I totally agree, and that's what I was getting at.
Yeah.
I don't want us to get into that box again where only 1 and 2 are the ones.
Yes,
that are
right,
gonna
it makes it hard, I think the staff would agree, I mean, Megan
And
Donna,
I would defer to you,
and
Donna.
for you guys, it's hard to do that too, right?
I think that's where the implementation plan or the other strategies, because I don't wanna give,
Yeah.
titles to people, but I'm looking forward to seeing that, right? Like within the actual design, it's not that we're prioritizing more, that's just the design of it.
Right.
It would,
So-
wherever you look at.
Yeah, and I don't, there's no intent here to make it low or high priority, it's just the way it's implemented. And also, for example, the data-driven one has much more organizational implications in the short term, right? You're gonna have to hire a director of data and insights. Okay, once that's funded and that's hired, then you need to look at the tools, but that's not a forever funding situation, right? It's gonna change over time as you get the people in their positions, the tools in place, and the systems going, that's gonna change over time, right? It's not gonna require the same level of funding, does that make sense? Yeah,
And I hope I'm not being critical, I just.
Oh, not at all.
Okay.
not at all, this is your plan. Like there's nothing here that was not created collectively, and it is absolutely critical that if anybody feels that in this moment, that they raise their hand, because this is the result of our collective work for the last 8 months, so absolutely want to make sure everybody feels.
I think what I'm hearing is that there would not be any limitation of funding to go to pillar 3.
Or 4.
Right. So
I see your comments as absolutely critical and actually really helpful. A lot of times we sit in front of boards and they don't understand the importance of investing in the infrastructure and those types of things. And all they want to do is fund both of them. And I really love hearing what you guys are asking, because I think it's absolutely critical. We have to both invest in ourselves so that we can better invest in others. It's the classic, like, put the mask on yourself before you put it on the child next to you, right? So
Depends on the child.
Where you're playing.
But that's a great point on the infrastructure, because if we really are talking about the 30-year vision for really being the healthcare catalyst, you have to have that infrastructure.
Exactly.
And so and Chris, you made the right point, is that I understand that 1 and 2 will probably have the majority of funding aspect, but we can't ignore 3 and 4, there has to be district investments in those people. potentially would be a major mistake.
And
But I
also,
agree with Lynn.
Yeah.
But I agree that there's a huge potential for leveraging dollars.
Yes.
Within 3 and 4.
100%. And also because pillar 4 especially is the fuel
Yeah.
that is going to enable the organization to grow.
Yeah.
Right? So I think we're all in agreement. We've answered all the questions. Can I get everybody to vote on this and just say yay, we can go to the next one?
I'm good with it.
Yay, yay, yay.
Yay, yay, yay. Okay, I love it. All right, so Leia's gonna take us through pillar number 2.
And before I do that, I'll just point the next page is always a tactic toolbox. Right, for each initiative, you have the list of tactics, and like Sophie said, we collected these from the board, the staff, and in the community sessions. They're not validated, they're not prioritized, they're a reflection of what we've heard. And it'll be up to the organization, depending on how the implementation plan goes, on how those will serve as a guide for the organization, but we thought it was important to include them.
Yeah, so I just wanna say, I'm sorry, I said at the very beginning that this plan will necessitate organizational change, right? So what we envision, this is going forward, this is a look, we have to do a couple of things at the same time. What we envision for the organizational change would be to have a director in charge of health workforce, a director in charge of awareness and access. So they become the expert. Right, so when they look at tactics, they know the context, they know what has worked in the past, what hasn't worked in the past, what organizations have succeeded. So that's how they're going to be evaluated. Okay, and then of course, you also have a new department with the data and insight. Like I said, you'll have a director there too. And that person, he or she, will feed the data back to the teams, obviously. What's going on in the marketplace, what's going on with consumers. And so yes, that's how the tactic toolbox will be used. And also it can grow. This is just like, who knows? There may be lots of different tactics.
And so are
Yes.
we gonna go over the tactics tonight or?
Well, no, so we can,
No, we don't have to, so.
but as we see it, it's like, it's really not something that will be approved by the board in this
I
moment,
see, I see.
right? Because they're ideas, and as you go forward, you could implement that, the staff can say, yeah, we have a great way of implementing that.
And so that's where staff would play a role in looking at attack.
Exactly, evaluating them, and then coming back to you and saying, this is a great idea.
Okay, then it might, yeah, I did. Thank you. So I guess it's not a question for later, but I was gonna ask about the recommendation, saying director positions, various things, like what those recommendations were based off of, like, is that comparison to other models, other places, other districts, like,
So
how do we come to that?
yeah, so literally, so again, we talked about that with the staff today and said, where are you today, right? What's working, and what we know the roles and responsibilities are today. And we just gave the recommendation that it would make sense to reflect the strategic plan. Right, so if you're going to be a data-driven organization, we really highly recommend that you have a dedicated data and insight person. That's whose job is only data. And then, but not only that, but because as you remember, we'll go through this, data has two roles, right? The internal and also external for partners in the community. So that we felt warrants, again, those are just suggestions, it's up to Chris and to you to say, we feel that's true or not true, you know what I mean, like that would be our recommendation, it would make sense to dedicate a person to those pillars. The other thing we discussed today, and again, this is up for discussion, it's not a final recommendation from us, is having a person at the oversight level, like maybe COO, who knows what's going on across this organization, because but the other thing that's really important is even though we are aligning against the pillars, it should not be siloed, right? There needs to be a lot of cross collaboration across the pillars. Cross-functional, cross collaboration.
So what you were describing just now was about the director of
Data and insight, yeah,
no, it will be before.
workforce development.
So what you're proposing then is that the district would transform into having some oversight on these programs, these incentives, these different tactics that are available to increase That's a big change from what we currently are doing. And I'm just wondering, you know, that's, and I get it, that's, that would be pretty, I think, strategic to do that. I'm just wondering how, if there's enough awareness of a lot of the community that we have been serving, that this is going to be very different.
So let me reflect back to make sure that we're speaking.
Because before, we would give a grant to an organization like, let's say, Intercare.
Mhm.
Let me not use that one because of. But you're gonna say, we would give a grant to BAP.
Yeah.
Okay, and we would give them a grant because they are asking for us to fund 3 positions. For expanding their programs to Eastern Coachella Valley.
Mhm.
Okay, so this director of personnel or staff workforce would then evaluate it and provide input on that ask moving forward.
Correct.
Okay, and so then that's how we could evaluate the grant now. It would not be on the previous milestones and so forth that we would look at.
Right, so you would evaluate it, so it would fall into a key initiative. Right, so the person in charge of this pillar, right, would look to see what initiative does it fall under, right? And is it going, if we fund that organization, is it going to help us reach this goal? Because as an organization, we know that this is one of the greatest needs in the community. And if we reach this need, we will make measurable impact on the community. That's the way it layers up. And it is a new way, you're 100% right, of operating, but it is a much more strategic and accountable way. And also, this is what I said in the beginning, which makes more sense now. It's a much more proactive way.
I get it, I'm learning, because we put this together and I'm just learning on how it will actually function practically.
Yeah.
And how this will be, impacting prospective grantees.
Yeah.
That only the ones that are falling in these pillars are really going to be able to move forward.
Yeah.
Whereas before we were on the.
May limit. Those of them.
Remember? Yeah, and remember when we started and we said, when we choose to be strategic and we do all the due diligence to say, if we focus on these goals, we will make the most impact. By default, we're saying no to some things. And it's not because and I think it's really, really important to say, it's not because it's not, those other things are not important. But again, we're trying to find that nexus of our abilities and our capabilities as an organization and the needs in the community and where's the greatest overlay.
Can I add or ask, because I would envision that the director of the workforce section is not only analyzing grants and how they fit within the strategic action plan, but is actually building other relationships with workforce development.
100%.
Okay.
100%. And that's why I said it needs to have cross-functional
Right.
and cross-communication. Ori?
Think of them as the CEO
Yeah.
of
That pillar.
that.
So it's not just internal relations and operations, it's external as well.
It's also trying to predict and understand what's coming down the pipeline.
Yeah, okay. Right.
It's working with the director of data to say, here's what numbers are showing us, here's the trends, here's what we need to prepare for the next 5 years, because we're seeing this change coming down the pipeline.
For example, an example would be how we leverage our dollars with like Saving One Future or the county workforce development or whatever that may be, or Intercare in there.
And Angelica, I see your hand. Do you want to go now or should I just?
Oh, it's not her hand, I think it's just the.
It's that
I have my hand like this in front of your face and I'm like, oh my gosh, I missed her.
Nope, it's me. I'm good.
We were talking about, to your point, Greg, is that, for example, for pillar 3, right? You can have a partnership that comes and says, we know we could do this, but the first thing that person in awareness should do is say, does it fall under pillar 1 or 2? And if it does, then that should be the role of that pillar to evaluate. And if not, if it's going to be a partnership or a caliber, what does that look like? So yeah, I'm really, really so enthused that you're seeing this come to life, because this could be very dry and it's like plan on. But this is like how you're gonna show up in the world. And it's really for us, success is that you use it. All right, fabulous. Over to Leah for pillar 2.
Okay, great. So you can move to the next page, so it should say proposed V2 pillar 2. I'm sorry, it's so small on the screen, but hopefully for those on Zoom, it's fine on your end. So high level here, similar to pillar 1, this was enthusiastically accepted by the community as a major need. We heard about first the great influence of Promotora as community health workers and the role that they can play in the community. We heard about some of the barriers that individuals face when it comes to accessing care, whether it's long wait times, transportation, language barriers, cultural competency barriers, and it really reaffirmed that this is a true need of the community. When we asked you all, the board and staff, to do a alignment exercise on the initiatives, all of the initiatives within pillar 1 and pillar 2 all received average confidence scores between 90 and 100%. So these have clearly been validated by yourselves in the community, in addition to all those data sources that Sophie had shown. So I'll start with that. And on a pillar level, nothing has changed. It is to equitably increase awareness of health services and access to primary, specialty, and behavioral health care services. And I also want to be clear with these definitions. When we talk about the primary, specialty, and behavioral healthcare and healthcare professionals, we're using the same definitions as the original strategic plan. So we want to make sure that things are consistent. In terms of the goals, there is one change that we made. You might remember that we had 3 goals previously. So we have the awareness piece, and that has remained the same. Nothing has changed there. The initiative is the same. And then we had 2 access pieces. So we had a physical access piece, and then we had a digital access piece. What we chose to do, because we found that whereas the digital access conversation did come up in community sessions, there's a lot of conversations around, well, a lot of communities still don't have bandwidth or internet access or the means to create telehealth, and it wasn't a key priority. And so what we originally had was 2 initiatives under digital access. So one was about increasing the availability of telehealth, and the other one was about increasing the availability of tools and resources that facilitate telehealth. And what we did is we folded that into engagement, because that is something where partnerships will be key. How can we work with these different organizations, and Alejandro had brought up the school buses that have internet service, and that really is an engagement and partnership piece. And then what we did is we folded in the digital access, so actually increasing telehealth into a goal that we just relabeled access. So there's now 3 key initiatives under these. There's the in-person care infrastructure enablement, and that is number 1. That received an average of 100% confidence score. So this was the top rated initiative of all of the initiatives that you looked at in your exercise. So that is now the key initiative of this goal. Then there's high need access expansion. So this we already had, and this remains something that's really important, validated by the community. And then there's digital access enablement. So we're still keeping that component of expanding access to virtual care by supporting telehealth service delivery and supporting people's ability to use those tools. Any questions on these?
No questions, but the comment on,
Yeah.
I think it's really smart to combine the digital under access, because more health organizations are looking at healthcare delivery for not only physical brick and mortar locations. And if you separate them, then you're like, well, which one is more important than the other?
Yeah.
When they actually can all be combined, so I think that's a very, very smart thing to do, so.
Yeah, I mean, I think that, the overarching lens has been like, how can we action this? What's the easiest way to action this? So that, yes, I'm glad you agree.
One question I would have is on 2.2.2, so the high need access expansion, would an example of that be like the mobile clinic?
Exactly. That's like the key example, the one that we touted at all the community sessions, because everyone recognizes it and knows it. So
Just trying to
absolutely.
allow you to employ it, so.
Yeah.
Yes, I have a question on, condition 2.11. So coordinates coordinating appropriate responsive approach to health awareness and navigation. So that residents can easily understand what services. Okay, so if the services exist, then yes. Do that approach, but if the services don't exist. Would that be addressed in pillar, the one before, pillar one, and having the staff in place that the people or the, okay.
Exactly, yeah, these will go together, like when we asked the community about the barriers to care, it was not enough providers and then long wait time.
Long wait
And so
time.
we know those go directly together, there's long wait times because there's not enough providers. So definitely there's a lot of crossover between these. And then part of that also through the high need access expansion, that's also increasing services. And I think a huge component of the connected care navigation initiative will be working in partnerships with promotoras, community health workers that came and presented themselves at the community engagement sessions and play a huge role in increasing awareness.
It's just a lot of questions, I can understand it.
Not enough providers, but then there also could be the gap in provider services.
Yeah,
You know,
yes.
it's like you can say, okay, we don't have enough primary care doctors, but we don't have any pediatricians.
Right,
Yeah.
the specialty, I think that, yeah, the both are true.
Yep, and we have like in the community engagement report, we identified a few specialties that came up over and over that there was a shortage of.
Now we're getting into the activity.
Yeah.
When you're thinking about the tactical.
So, and then I would talk about partnerships with it, because you were highlighting community health workers, which can.
Yeah.
Just a partnership there is that those can be paid through Medi-Cal.
Mm-hmm.
And so it's not, doesn't always have to be a district investment in that. If we're building, say, a system of community health workers. And I was on the call this morning about this, but it's if they're seeing 9 to 11 patients a day, that's fully recoverable by Medi-Cal.
Mm-hmm.
And so I think that again is where we look at how we leverage those partnerships with organizations as well. And it may be that. One community health worker may work with more than one, say, CDO.
Right.
To fulfill those requirements to do that, so. And then even to the work that you do, is like, as you ramp up all these clinics, we could probably justify a community health worker. Oh, how we bill for it is another thing, because billing through Medi-Cal is even, but I think you can work, and I think there's some exciting partnerships that may be through the county, through public health, that has a whole community health worker hub now, and not to get too far in the weeds, but it's just as we're going through this, I'm gonna think how we're leveraging. Because you make the point, it's like, some of this is gonna overlap on each pillar.
Yeah.
And I think that's really, I think that's what the value of what this is looking like to me.
Because the model that we could look at is the COVID-19 response.
Exactly.
Where we had, we
Exactly
were
right.
the umbrella that we had all of these different promotora groups like Misión y Compromiso, El Sol, and ODEC. That they were under our umbrella, but we were guiding a lot of the activities, a lot of the events. We were coordinating all of that, so we could, that's the
And
model that we could.
Funded partly by the county.
Exactly.
Yeah.
And we just have to figure out if we're hiring internally versus externally.
Yeah, and that's the conversation you go through with the MOUs with public health and stuff, because. We don't wanna get into, I'm sure Eric doesn't wanna get into the business of billing through Medi-Cal. But I think. It's definitely a partnership that can happen, and I think especially us as a public agency. It's easier for us to create that relationship with the county than say what a nonprofit would be able to do. We're heading that way, but if we're really looking at how we implement this kind of stuff over the next 1, 2, 3 years. I think there's a real opportunity, and you're right, we have a model already, we've already shown it.
Then it's tied to the digital piece of it, because build out Connect IU, build out 211, there's all this kind of.
Well, yeah, and we're building a whole new digital platform through 211.
And I think the awareness piece of it too, I think they're crucial in getting to the homes themselves and we actually raise awareness about the clinics, about the services. That we'll be able to provide our partners, will be able to provide, for example, this Saturday. We hosted our first pediatric clinic already at Guadalupe with PPG Health, who now has pediatricians. So we were able to partner with Unidas por Salud, which is with Conchita Versada. And we were able to feed, we saw 9 children and 2 adults out of that first ever clinic on Saturday, so they were out there, they were actually doing the outreach, and they were bringing awareness of this new clinic that was being implemented at the church, so it goes hand in hand with a lot of the work that we're doing.
Thank you, Director Smith, did you have?
And yeah, just a question, so from your the last report you gave, you mentioned brand recognition being low. So is that contemplated under here as far as awareness? Cause I know we're talking about awareness of services and resources, but to begin with,
Yes.
we have a low.
So that's a different kind of awareness, but when you look at the organization chart, we definitely have marketing. So currently being headed out by Will, and that will definitely have to be considered in terms of brand awareness. So that means, you know, redesigning your website, having a clear brand strategy that, you know, communicates to the community all of the good work that you're doing, all of the, you know, services that are available. So brand, and it also feeds into the data pillar, like adding the data to show back to the community. We are making progress against these goals, using qualitative data to show the impact from a qualitative perspective. So that is that the brand level is a separate finding, but it's a very important thing.
Yeah, because, you know, as far as brand awareness, but also like trustworthiness. Trustworthiness
Yes.
is being able to, you know,
Yeah.
share the information and, oh, okay, the healthcare district is, you know, sharing this as a trusted brand, you know, kind of starts there, or else someone can see it, and be like, well, no.
Yeah, exactly.
They don't know what they do.
Exactly, and you know, and that also part of the implementation going forward, so having like a directory on the website, I'm just making this up. A directory on the website, and then, you know, the district healthcare is on other people's websites, clearly co-labeled and co-branded as funding those initiatives, so now is really important. We looked at a couple, like we talked to the Association of Healthcare Districts as part of our research for this project. You know, they named a couple of other healthcare districts. I think Fallbrook might have been one of them that does a really good job of co-branding with all of their partners very consistently. As Will knows, it's all about consistency, you know, it's like, and I think that there's a lot of goodwill. People who know your work think you're a great strategic partner. I mean, you're coming from a very strong position, but there's definitely a lack of brand awareness of all the work that you do. And going forward, that has to be part of it.
Yeah, Walker has their own community resource center that they operate.
But like when you do, like, you know, the clinics and all those things. Billy, I'm sorry, you were behind, so I didn't see your hand raised. Do you have something you want to jump in and say?
Oh, no, I just wanted to quickly co-sign on what Director Rodriguez just brought up in terms of having Medi-Cal reimbursements sort of be leveraged. That's sort of exemplifies the ethos of the financial sustainability framework that we're using, because every decision that is made should ask the question, just as a default, are there ways that I can leverage supplemental outside partnership creative resources to offset the cost of capital to maximize the district dollar moving forward? And that's just like, I just want to elevate that because it's a perfect example. So thank you.
Thank you, Billy.
One thing, excuse me, that I would like to do is, since we do open up for public comments on specific agenda items.
Yeah.
I'm thinking it might make sense, that we do it by like pillar.
Perfect.
So right before
Wonderful.
we get on this pillar, we'll open for public comment on these two that we're covering, and then we'll do one for each.
Thank you for that. Yep.
And I
Okay.
think, I think we're ready to go to a vote, and Director Smith also to answer what you would ask, because the brand awareness, we'll see it in the data driven. And that data pillar will also play into awareness, because a lot of organizations operate in silos and there's not the best referral network. So, you know, people getting to the right places through the organizations that they already work with and trust. And so that'll definitely cross over a lot as well. Okay, great. So can we vote to approve Pillar 2, its underlying goals and its underlying initiatives?
You want to approve it before you get public comment, or you want?
Yeah, we can.
It's a thumbs up to get rid of it. Yes, no. No official, and no official vote.
This will be the last time this is the last fine check, so we just wanna make sure that everyone.
I always like yay and then thumbs up.
Exactly, we have you on tapes.
Alright. Good, any public comment on pillar 1 or pillar 2? Yes, go ahead, 3 minutes.
I'm Dr. Sullivan, and I have a comment on 1 and 2. So I am a healthcare provider, professionals. And the idea that co-branding is fabulous. Because there is a shortage in every health professional group, medical, dental, physical therapy, nursing, pharmacy. So to be able to co-brand with you guys and all the work you've done, like, I don't know why you wouldn't want to figure out how to co-brand. Because you know, I have so many ideas of things that we could do to attract students in that would be in, and Director Rogers and I talked about this morning, creating places where students can come and practice in a rural environment, but they are safe, they're in a protected environment. This happened to me when I actually had a rural affiliation in Virginia. And the facility had a place where the students could stay. And so there were students from medicine, physical therapy, occupational therapy, nursing. We were having a great, but every night you came to the facility where you were safe and you were practicing in the rural area. So it was actually creating a co-branding with, and it was the Rehabilitation Institute of Virginia in Fishersville, Virginia. And I learned so much about living in a rural area, and I never would have. I was from Milwaukee, Wisconsin. Okay, so that's an example of co-branding. And you get a win-win, a big win-win, because you're getting people coming into the area who actually will stay here because they get to love the community. So I speak highly in favor of 1, 2, and then co-branding. So thank you for letting me know.
Any other public comment?
I will just say that I was recently invited to the Eastern Riverside County and Imperial County collaborative on ERIC that is being pioneered by InterCare, and was very, very much in line with your pillar 1, all about that. And I'm sure you all have heard about ERIC because I know you just approved the grant for the residency program for InterCare. But there were a lot of people in that room, which is saying a lot, given that it was a room in Imperial. There were a lot of people in that room who were really, really invested in the same workforce development pieces, both here in Imperial County. So I think it has a great potential for lots of synergy, and then I will hold the rest of my comments till Philly. Because everybody knows I'll have a lot to say.
I support that one too.
Thank you. Anyone else? Do you have any other thing?
I just had a sentiment stood out, and I don't know what works best for it, but in pillar 2, we're referencing primary, specialty, and behavioral health care. And then in pillar 1, we kind of phrased it a couple different ways, so that was primary care and specialty care. So I didn't know if there should be a consistency with that, or if there's it's better to leave it as gray.
There should definitely be consistency in that, so we'll review it. I think the only difference would be between like professionals versus healthcare services. But otherwise, the order should be consistent. So I'll take a look. Thank you.
And I would say primary care or specialty care and behavioral health services. I think.
Yeah, I think
that would be.
It's meant to be right.
Good point.
Yeah, it's just a race.
Yeah, but consistent throughout.
So primary care.
Specialty care and behavioral health. Care.
We can then move on to the next one.
Yes, okay. Pillar 3 is the strategic engagement. So as we said, we're not doing primary or secondary, but this was probably the one that got a little bit less support. I think that the feedback from the community was that there's definitely a clear understanding that social connection and things that are more than just access to healthcare, that the daily living conditions of the community highly impacts your mission and your vision, right? So everybody agreed on that. I think that what we need to see is that from the community input, there was this housing stability was one that came up again and again. So just so you know, that is definitely an important goal, which is why it's here as number 1. So Just to repeat, under strategic pillar engagement, engage in strategic partnerships, programs, and funding to equitably address essential social determinants of health. The first goal, 3.1, is neighborhood and built environment. Strengthen neighborhood and built environment conditions. Like I said, the first key initiatives is healthy housing and stability. And then the second one is environmental health and climate resilience, which again, we heard over and over again from the residents. Angelica, please feel free to jump in at any point if you want to highlight something that I'm missing.
I got you covered, Sophie. You're doing great.
And then for goal 3.2, we just switched these two because community safety and well-being kept coming up again and again as a primary concern. So we have 3 key initiatives under goal 3.2, promote nutrition for health, which we know. Yeah.
Can I go back to 3.11, so healthy housing. Did you say you wanted us to wait to the end or? No, okay, those for public comment. So on this one, okay, again, I'm trying to just throw things out there to make sure I understand this.
Yeah.
If we have somebody that is saying that we have a group out and we have services that we want to deliver out to Desert Hot Springs or North Shore. Okay, and I'm looking at it and I'm thinking, okay, is it housing, healthy housing and stability, or is it in-person infrastructure? It's not there. It's not highly active expansion, but being able to provide support for them to be able to connect, like with if it's a special transportation, working with Sunline to provide some transportation, or some of these these groups that provide transportation. Where would that fall under?
That would fall under here, 2.22, so support programs and non-traditional delivery models that facilitate and expand access to services.
So these would fall under access.
Okay.
So although I would also argue it does fall under 3.11, because if you're talking about housing stability, that includes infrastructure, includes transportation access. A lot of funding for housing is associated with transit hubs. And I see it falling under both, so it's not one or the other. That's a great point that you made. But because for me, and I work in this field, obviously, but is housing stability is so much more than building housing. It is the infrastructure behind it. Is for if you have permanent supportive housing units in affordable housing developments, it's this wraparound services around that. So stability to me, it's the infrastructure aspect, transportation, water, sewers. So I think what you've done here, though, you captured that instead of listing,
Yes.
45 million different things.
Well, that's where I thought that it would, that's what triggered it, it's 3.11. But it made me wonder, is it clear enough in there? It made me wonder to the point that I had to go back and look at 2.1 and 2.2 to see where does it, I guess it's not clear enough for me. If it's not clear enough for me, without you explaining it, is that gonna be clear enough for staff and the community that that's where it would be? Especially staff, we really wanna make sure that they all are on board with this. So.
And
But those fall under the tactics and
Sorry, Angelica?
And this is where we get into some of the recommendations that we outlined around decision-making and evaluating engagement, projects, partnerships, and collaboration. We've laid out some decision trees. We've outlined some key evaluation recommendations to make the decisions very easy to consider. The thing that was so important that Sophie mentioned earlier was the need for cross-collaboration because these topics are so intertwined. And so as we talk more about those decision mechanisms and an approach to evaluating potential partnerships, the RFPs, so on and so forth, we have those instructions there to make sure it's really clear.
But the net is that all pillars should talk to each other.
Exactly.
There's a question. And this pillar in particular, the first question should be, is there a partner that's doing this work in the district that we can partner with? Is there an opportunity to issue an RFP? Or does it go into pillar 1 or 2?
And if you're issuing an RFP, we also have those recommendations what is the district's very clear role in convening or supporting? Are they having multiple collaborations with itself? Because you don't want to continue to have just one group submitting a proposal in response to the RFPs. We need more collaboration to ensure there's an integration of services and real open to access across the board.
So with that said though, is that when you have an RFP, sometimes you have an RFP that is very easy for many organizations to get through because they're providing for the higher number. But what is hard is when you have that's, again, the harder to reach areas that organizations may not be looking to provide the services there. And that's where it all comes down to equity, where you have to make considerations, you have to make you provide incentives. Hey, instead of just cutting off in Coachella, can you look at expanding
Exactly.
So
that's exactly it. And thank you for bringing that up. I think that's part of the reason why we want to see more organizations doing the cross collaboration and to ensure that the district has a clear and definitive approach to how they are engaging, how you all are engaging when it comes to responding and funding and convening.
So if you can just kind of think about what the conversation is when we started with back just like Greg said, it's not just about physical stick-built houses, but the environment that they live in. I'm trying to search where there's a little bit more clarity. I understand what we're saying here and it's making more sense to me, but as I'm looking now to the tactics to see whether it really does, again, different examples that are coming to me right now, is to kind of look at different possibilities. And the tactic toolbox two seems to have those supportive services that might actually come into play to actually increase equity possibilities, but they fall short in that strengthening coordination across providers to improve. That will be fine, except it's specific to community-based behavioral health supports. So that kind of say, okay, well, up until then, it was fine. And then the next one, advance equitable access to digital services to reduce isolation and enable access to all of that is, again, we're getting to what I'm saying, those difficult to reach areas, but this is only specific to digital. So I'm just not sure that in that, 15% of the population that I'm thinking of right now, when we're trying to think about how we actually thinking about every possible scenario that we can think of, I don't think it falls into any of these. So I don't want to hold us up any longer, but that were my comments just for this particular section that we're in right now. And just think about the lived environment. It's not just about the how it's what's the environment that's being created that is actually the obstacle for families to be able to access services. I don't think it's addressed here, but correct me if I'm wrong.
No, you're correct, and thank you for sharing that. And I just want to reiterate, the tactics that's not a comprehensive list. These are just the ideas that we've heard, but it'll ultimately be up to the district what you choose to focus on. And it could be exactly what we said. So I don't want anyone to assume that this tactic toolbox is like, this is all that you can focus on and this is what you're limited by. These are ideas that have surfaced, but in no way should they limit the organization.
Right, so I just want to make sure that we are in agreement. What we're really voting on or making sure is that if we have said that a goal 3.1 neighborhood and built environment, strengthening neighborhood and built environment condition is a very important focus and goal. If we achieve progress towards that goal, we will achieve progress towards our pillar and towards our mission. And the way to achieve that goal is to focus on these two key initiatives that have come out through all of the data and the community sessions as being the drivers, where again, we're saying like the biggest need and what we can do to create impact. So what that is saying is that if we focus on healthy housing and stability, whatever tactics we choose, but if we focus on that initiative, we will make tangible impact to the community. So that's what I want to make sure that you are in agreement that we say, if we focus on creating healthy housing and stability, which means supporting programs and aligning partners around strategies that improve housing stability, integrating health supported services in the district, that we will achieve our goal 3.1. That's what it's, so it's not.
I like 3.11, I like 3.12.
Okay, perfect. So you're talking about the next level.
I'm just thinking is that there is something that's missing there. It's where, and maybe it is under 3.11. I like it. I just was, again, I think that sometimes we make it where we create a system that works for 90% of the situations, and then there's 10% that I just don't want to. I just recognize that 10% is not going to be an easy fix. It's going to be a difficult.
The place where that 10% is usually, not always, but usually where that 10% is gonna be addressed is in the tactics.
And that's
It's
why
creating-
looking was for.
Is in creating a program that fits within one of these initiatives and answers one of the goals but is specific to a population that would otherwise.
And so, and to that
But-
point, yeah, and like, we said, at the very beginning, we always have to keep those populations that we've highlighted as a filter through which we evaluate everything. So it's also not gonna be reflected in the wording of a key initiative, but that is in the implementation.
I would caution us at this point to get into the very detailed work of thinking about and deciding what goes into plans. Here's why. One, we haven't agreed on, what are these yet, and we need to do that first. And two, that is something that should be done, quite honestly, in an ideal world, with those CEOs of a particular area. Because they're the individuals who will bring in the expertise, who will bring in the knowledge, to help us determine what are the right tactics that execute later down the line.
Thank you. Okay.
Question on that, one more thing on that, would that be the same thing for 3.2.2? As far as isolation and higher risk populations, because admittedly, before I checked the tactics, I was trying to find where our seniors. Information was,
Yes.
and I flipped it over and it's like, oh, okay, so you have it listed there, seniors, caregivers,
Yes.
individuals with limited mobility, but it's the same thing,
Yes.
stuff like, okay.
Yes, exactly.
When I saw that, I thought, okay, they're naming seniors because it is an important, that population is definitely.
Yeah, it's one of our key.
And so I guess, because you named it, I thought, well, I'm just wondering, seniors, I know I'm probably required to be taken care of, but when I think about when you think seniors, okay, yes. But then you have seniors that are farm workers, that are going to have more challenges than just seniors. That are low income, that, I'm just thinking that, seniors are that here, and we have 90% of the population can actually receive services. And then the 10% that cannot, so I'm just wondering. Okay, but I've already said my piece.
I want to make sure that you feel heard.
Okay, and I do, I think you get it, that I'm just kind of probably, like, it's probably taken care of, but it's just, I just deal with these kind of situations all the time where you have many organizations that provide funding for 90% of the services, and then 10% of the population, it's just too hard to serve them, so they just focus on
Right.
easy to serve,
Right.
easier to serve, not easy, but easier.
Right. And so it is definitely the role of the staff, right, to be able to get the data, especially because we're investigating data at Pillar 4, to get that data to say, this is what the senior population looks like, this is how it's broken down, this is where the greatest needs are, this is where we're best positioned to help, this is the greatest impact that we can create.
And based on that, here is a tactic that we can execute
Right.
to reach that 10% to make sure that they are not.
Thank you. Okay. I want to make sure everybody feels heard. Oh, go ahead.
One more thing.
Of course, of course, of
Of course,
course.
the seniors, so because it came up, like, I would say a lot, it came up definitely in the sessions and. You know, I don't know how much folks are gonna be reading into like the tactics, subscriptions, whatever, but like. This is kind of like the main thing, right? And so in reflecting that to the community,
Yeah,
and we don't see the word for seniors there in particular.
yeah,
To emphasize that we recognize that that is a group that, you know, faces isolation, loneliness and things along those lines, and we understand the significance of that, not at the exclusion of other groups who might also experience that, but we particularly recognize that seniors face these challenges, and so I just wonder from the standpoint of how it visually looks like, you know, as we're engaging with the community, it's in the tactics, but you gotta kind of
yeah, and
dig and get into it.
And it's also highlighted in so when we call out very specific populations, we do so collectively for all of the groups that were highlighted in seniors, youth, LGBTQ plus communities, and also under resourced communities and Spanish speaking communities. And then as a part of the report, we also have specific pages where we highlight these groups. And so they're called out in multiple ways throughout the reports. And I think those things would also be highlighted as they would be on the website and so on and so forth. So it's not missed. I think it's grouped in a different way. And so team, maybe we can adjust some of that as needed. But I also wanted us to remember that we've done a lot of work to call out these groups and highlight the groups that were mentioned in multiple community sessions.
And also, I think it'd be really important, it goes back to the stories, when we reflect the stories of impact, that also has to be incorporated. Right, specifically. Okay, yeah, so I think and also remember, again, I'm gonna repeat again, but the vision is all district residents. This is what this strategy, so we know that there are groups that need more attention and, you know, we need to reflect back to them. But at the end of the day, this is the vision for the district. Okay, the only other thing, and welcome, Dr. Lawson. The only other thing we want to show is that we just flipped these two because again, this came up more, the community safety and well-being. And then goal 3.3 remains economic stability, strengthen economic stability for district residents. And we have one key initiative there, which is to expand pathways to economic vitality. So again, this is very much about convening and aligning partners to extend access to career pathways and employment opportunities in the district, because we know that is a huge community need. Okay. Vote, questions, consensus? Is that your consensus?
Yeah. Oh, we're done.
Thumbs up?
Yeah.
Thumbs up, fantastic, okay, we're doing great on timing, thank you. Public?
Yes, so any public comments on this pillars? Go ahead.
Actually, I'm glad that. Because I think another one where, the role of this group is to nudge the county supervisors. Because there's 2.5 million in Sacramento, of which, 200,000 are special needs. So if you can't walk, talk, or think, you should be seeing you. So it's like, how can we funnel the patients so that we're co-branding with the county, I think. That's, I guess what I'm saying here is you guys have done a fabulous job of identifying the issue. It's really amazing. I've been waiting my whole life for this. And that's what it is. It's people with special needs. And I'm a person with special needs. It's like, I want to see this fixed before I die.
So you say the challenge is not addressing that?
Yeah, they have 3 pillars that aren't communicating. Housing, healthcare, and workforce development.
So as someone who works for the department that is named Housing Workforce Development, I would respectfully disagree, and so maybe this is something we could have a conversation about. Because the last 2 meetings I've heard this from you, and there's actually been a lot of work done in conjunction with the healthcare.
I agree.
So I just.
Also, I agree. Here's why I said that. This morning, when we were talking, there was a meeting with 40 women, she does her husband, and not one of them had primary care doctor. So we have to just reconcile.
Well, we can have
Let's do
offline discussion, but I just think it's important, since this is a public meeting, that
Yeah.
if comments are being made, like from facts, they need to be
Yeah, I'll say it again,
reiterated.
it's not being done. It's another, well, it's like, that's what we're gonna be.
Are we, you done with the comment? Any other, public comment?
No.
Thank you. Thank you, thank you. Okay, we're moving on to the last pillar. Pillar number 4, I think everybody's good. Okay. Okay.
So this one should be pretty quick. I think as expected, this obviously wasn't the most talked about pillar in the community sessions. But what we did hear was that, one, there's really specific data that these communities want to see collected. They want to know how long are wait times? How far are people traveling? They want the real tactical data that speaks to their experience, because as we've talked about repeatedly, it's that combination of quantitative and qualitative data that's really going to measure the impact and the success of this strategic plan. And then we also heard a lot about the actual capacity of organizations to collect data and to manage data, and the need that they have for support so that they can share that with other organizations, measure their own impact, and contribute to this concept of collective impact that we've talked about a lot. So all to say, this was all validated, and especially our partner organizations that were present, we're very excited by the idea of the support that we could provide in terms of giving them data and helping them have a reason for the programs that they do, and then also having this mechanism where there's shared data infrastructure across the valley. So and nothing has changed here, so this is the same as V1. And again, to reiterate, 4.1, which is data maturity, that is an internal goal. And that is, which we've said over and over, I feel like I'm like Sophie repeating myself, but to become a data-driven organization that makes informed decisions with a relevant and timely understanding of stakeholder needs and wants. And then within 4.11, there's strengthened internal data capability and governance. We've talked about this a lot today, and this is about developing the people, the tools, and the resources that the organization has to actually realize this strategic plan. And then also advancing outcomes and impact measurement. So we'll talk about impact measurement next, but that's going to be a huge component to the success of this plan. And one thing that I will point out, so you evaluated this in your alignment exercise across different dimensions than the other pillars because it serves a different purpose. And there was an average of a 97.5% confidence score in its strategic importance, this entire goal. But there is lower confidence on organizational readiness. So it was 70% for 4.11 and 65% for 4.12. So all to say that this is what hopefully we are guiding you all towards, but this really requires investment to be fulfilled and so that all your other pillars can be as successful as their potential. So with that, and then 4.2 is that external lens, so enabling shared data access and insight, and then also convening regional learning and insight, whether that be through more community sessions, creating coalitions of different kinds of organizations, and being that spearhead convener. We've talked about, can we do a yearly survey similar to the one that we did with community engagement sessions so that we can start to measure year over year changes and responses. So yes, that is strategic pillar 4. Ori, anything to add before?
No, I mean, I think beautifully done. The only other thing that I would consider is the sequencing of these two goals. 4.1 has to come before you can actually execute meaningfully and impactfully on 4.2. You have to invest in 2026 and 2027 in building that infrastructure that we were talking about earlier. And that means the right people, right tools, the right mechanisms, right?
Will this be added within the implementation? Yes, and timelines and benchmarks for this.
Absolutely. And that has to come before you are able to become the convener, the aggregator, the shared data sharing hub that we want you to become. If you don't have those people and if you don't have those systems, you'll be making it up.
But just to on this, that I think then we talked about this before, I just want to reiterate that this pillar is so important to pillar 3. Because if we're really gonna leverage the partnerships, we've got to have the data, and especially if we've got collaborative data with other organizations, right? For grant opportunities, for government funding when it comes back, not done with. But that's why I'm really glad that we've highlighted this as one of our strategic pillars.
I actually, I think it's important to all three.
Yeah, and I agree.
To the earlier point, right, that you made, we're gonna be flooded with a lot of asks.
Yeah.
And we're gonna need a mechanism to decipher that alignment that Sophie was talking about, the things that our stakeholders need on the ground, what's actually needed versus what are we actually able to do to find the biggest amount of impact while not leaving behind those 10%, right? To do that, to know where that overlap is, we have to have that.
And there's a lot of
Otherwise, they're literally
appetite.
just guessing.
There's a lot of appetite from partners too, who said they're collecting data and they need a backbone to share it all together. So it's not just, starting from scratch, there's a lot of data out there.
Sorry, you took it, exactly, the partners have been asking for data, the hospitals don't have it, the county has some data, you guys have great data, but like, it would be nice to have that and come from a very not non-biased, but an organization like us that are really looking at how this impacts the health of everybody.
But even the county's data is, I mean, we're getting better, we're going through a whole process now with the.
For sure, they have some data.
But it's more 30,000 foot per se, that it is really granular.
Yeah.
We have some of that within each department, but to actually be able to coordinate even with the district.
Imagine sending it back to the county, say, hey, look, actually, you gave us this, but look what we found on your data. Oh, I mean, you're gonna be able to impact policy with data. You really are, because when you go to speak somewhere, you go to the state legislature and you say, hey, here's what we collected in our county, look what's happening here, here's the good things, here's the bad thing, this is why we need to be supported. They're like, oh, wow, this is great.
Exactly. Okay, well, actually, this is a perfect segue, because as I said, the objective tonight is to agree on all of the pillars, all of the goals, the key initiatives. So that once we have this agreed to strategic plan, we can start moving into the exciting conversation of how do we measure impact? And how do we use data to make this, so can we get a vote on this 4th pillar? Yeah, thumbs up, okay. So then we're going to open public comment.
Well, I like this, we just implement this.
Yeah, we should say.
What is this, what is that?
Yes, no.
Well, we can just use the.
So, we're gonna turn it over for public comment. I do wanna remind the public that, comments are addressed to the board and that you only have 3 minutes. Any public comment online or here in person?
Oh, I have 2 minutes and you guys.
You get 3.
See Andrea doing this.
Okay, yeah.
The 3 minutes.
So again, I'm Jenna Jaime, I'm CEO of Hark, and I am just so thrilled that this is one of your pillars. And when you mentioned that the confidence and the ability to implement 4.11 and 4.12 is low, that excites me because we can help with that. We've done that for multiple organizations before. And so I'm really hopeful that there can be a role for us in that. I think, for example, we're working with one federally qualified health center in Northern California and that thought they had good data and has since found out through our services that the data that they have is not reliable and they can't come to conclusions based on that. And so recommending ways to fix that and how to bring that together. We've also done a lot of evaluation for various different funders, including collective impact and rolling that up. We've done some collective impact for RAP that helps synthesize, helps tailor unique grantee work. We recently did one for Kaiser Permanente for a nationwide evaluation where each of the grantees responded to their RFP in such different ways. And we were able to provide the collective impact evaluation of that. So I'm excited and I really hope that we have the opportunity to support you with both of these goals. obviously, I would love to support you on all of these, and so I just want to say, please, include me in the conversations. We want to be here. We're your local data geeks. We live here, we vote here, we experience all of these things, and we have great community-based, bilingual, culturally competent, born and raised here, data geeks on hand. So I want to be a part of this.
Any other public comment?
Can I ask her for 1 minute just to introduce, I'm not as familiar with HARC, do you mind if she takes a minute just to kind of explain to me what HARC is, do you have time for that?
You wanna do that now or offline?
Either way, I mean, everybody else knows what HARC is?
Yes, we founded it.
Good. I've read this stuff online, we'll talk afterwards, I just wanna hear from you, it'd be great.
I can do the whole history. Any other public comment? Person online? Yeah, okay. Thank you.
Okay, I do have a comment now. I'm okay up until this point. I just wondered if there was something that was left out from things that were brought up at community meetings. Where can that be mentioned?
What do you mean?
Like, for example, if there's things that were brought up at community meetings and there was
There are tons of my times.
Okay, so I'm not gonna bring it up right now, instead I'll talk to you afterwards.
Well, I think I understand your question. In the community engagement report, what we did is a tactic toolbox. And that one you'll see is even more expansive than what we included here, because that was like all of the ideas that people mentioned. And people mentioned ideas that were super specific. Like someone had mentioned, okay, let's focus on re-recruiting providers who left during COVID because of burnout, right? Like those specific ideas were captured in the community engagement report.
But those could be taken in, and you could actually fit them into something.
Yes, some of them
That is
were.
not, that has not been identified in here, but that was brought up at a meeting, and again, I would rather talk to you about that.
Okay,
I want to make sure that there will be an opportunity for some feedback on this, because we're not ready to do it, we're just moving forward.
So I just wanna clarify that. This is for discussion for today. The working document that you should refer to and the staff should refer to is the community report.
Okay.
Which actually covers all of that. And this is for working purposes. It has even more information on potential, the community had a lot to say, so it even has a lot of information on potential partnerships. So everybody's voice was reflected and heard at all the tactics, so do not use this as the final thing. What we're using this as a final thing is this part. Right, because we couldn't, literally, we know we couldn't fit everything back from the community report, because it's like over 40 pages, so. That is where that is being captured, and it's really, really important to mention that, because as you know, the community reports we put online, so the community can read that report and see their suggestions reflected and outlined.
Okay.
So that's where it resides.
Okay.
Yeah, for sure.
Will is working on the marketing and communications plan, and we're getting it translated to Spanish. So that is done. It'll
So it's
be
really,
public and
this is not the full list.
Okay, good. It was in the other one, it was in.
Exactly, because this is just for, to give you an idea of what this could look like. So, wow. I just can't say thank you enough, congratulations, we should really, really take a moment to just, first of all, commend you on all of the work that you've done in the last 8 months. All of the collaboration between the staff and board, all of your dedication and your involvement, we're so grateful. And it's not complete, but this is a big milestone. Now we have the plan, and we're gonna focus on measuring that plan, implementing that plan, funding that plan. But this is a huge, so I hope everybody wish I brought champagne and think. But yeah, so anyway, I just wanna say congratulations. I hope everybody goes away tonight thinking, okay, we've done a big chunk of work. We're moving the organization into a whole new potential, which is very exciting. And I think when we started this work together, we really said, there's this new opportunity, this lease agreement, how do we meet the opportunity? And how do we look towards the future to see what we can become? And I think that, you've answered that with the strategic plan. So that's the end of our work for tonight. We will see you on Wednesday when we start talking about how do we measure impact to show that we're implementing and making progress.
Perfect, well, thank you, Team Soren, before we conclude the meeting, are there any comments from board?
Yeah, I do, and I apologize, I'm not gonna be here Wednesday, I'm gonna be at work, like, operating, but. But I actually wanna say, and I've said this before, is that I've been through numerous strategic planning. I am so impressed with the work that you've all done. Most of the strategic planning processes I have been, they get feedback in quotes, but then they come to you with what they think the plan should be. This has been totally opposite of that. Just the input from the board, the staff, the community, and how you have molded that, I'm completely impressed. So I think we did an amazing job, and thanks to staff for highlighting them as one of the best we should make. And not the most expensive thing. But I really wanted to end with that too. I know we're not done, but you know, you give us a lot of kudos, but I just think you all need to hear, both in the room and online, of the amazing work.
Thank you very much. We appreciate the feedback.
Thank you.
Have a great day, comments?
Thank you.
And we're gonna adjourn this meeting at 6:05. Thank you.
Thank you, everybody. Have a good night.
Bye-bye.
Okay.
Is,